and good morning. We are streaming spine surgery live from Duke Spine Institute here in Florida. We're located in Melbourne, Florida, just outside of Orlando. Our patient travels to us from, where? The Villages. She's a Floridian. Her and her husband are here. Originally from Minnesota, but they're living in the Villages now. Village is a retirement community in Florida, very large, one of the largest retirement communities in the entire country. And she has a large disc herniation at C4-5. She has other smaller disc herniations, but the C4-5 disc herniation is the one causing her symptoms. And we're going to go in and fix that disc herniation. She has spinal stenosis, disc herniation, radiculopathy, myelopathy, all related to this C4-5 disc herniation. She does not want fusion. She does not want metal or plastic put in her body. She wants a natural, safe, and effective repair of the disc. And that's what the Duke laser disc repair is. Henry, why don't we show our audience, while I'm getting access to the disc, why don't we show the audience what are the causes of neck pain, the most common causes of neck pain. There's about 30 of them, and a disc herniation is the most common.
Copy that.
I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Lateral view. Welcome back. So you can see from the video that there are about 30 different causes, specific causes of chronic neck pain. Chronic neck pain is a very common problem, affects millions and millions of people around the world. And for the longest time, we did not know what caused neck pain. Now we do. And the disc is the most common cause of neck pain. Disc injuries are about 85 to 90% of neck pain. Facet joints are another cause. You saw that. In this patient, she has herniated discs, and the big one is at this level right here at C4-5. Let's count vertebrae so we all know where we are. C2 is a tall one, 3, 4, 5. Everyone agree we're doing C4-5. So I'm going to do a discogram. We're going to inject dye. You're going to be able to see a tear in the back of the disc shot, as well as a herniation. Is that it?
Yes, sir.
All right. Shot. There we go. All right, show us the tear in the back. Yes, there it is. You can see the herniation. That's the dye right there, big herniation. At this point, I'm going to place a guide wire through my needle. The guide wire will guide my instruments so that I can place a tube and do the surgery. Everything is going well for her so far. Shot. I need to get the guide wire all the way in. Shot. When I say shot, what I'm asking for is an X-ray picture. There it is. Good. So you can see the guide wire inside the disc. Jordan is showing you with the arrow. You can also see the endotracheal tube and the esophageal temperature probe. Show us those. If you have questions, feel free to ask. Just type up your question. We are streaming live on YouTube and Facebook, X, and LinkedIn.
And we just broadcasted to Instagram today as well.
There we go.
For the first time.
Instagram for the first time. We'll be broadcasting live on Instagram every week that we're operating. We have 4 surgeries today. 2 are cervical and 2 are lumbar. 2 patients with herniated discs in the neck and 2 with herniated discs in the back. One of our patients traveled all the way from Vietnam. He's been watching our surgeries for 4 years. Okay, at this point, I'm going to take the needle out, leave the guide wire, and the guide wire will allow me to bring my instruments down to that disc that's damaged and fix it. We're going to use a laser and an endoscope to do that. Now that I've got the guide wire in, I'm going to place the dilator. The dilator spreads apart tissue like a pin going through your clothing. If you were to put a safety pin in your clothing, it doesn't cut anything, it just spreads it. So we're not doing any damage to her body under the skin. The only damage we're doing is a 4mm incision in the skin. Everything else is spread apart, and when we're done, it comes back together just like it was as if we weren't even here. That's the beauty of this surgery. It's minimally invasive, and typically there's no bleeding, just a few drops of blood. Patients get to go home an hour after surgery. In her case, she'll go home to a hotel tonight, and tomorrow we'll see her back and check on her. Look, not even a drop of blood. Okay? Shot. You can see, I'm going to move these Ratex because they're showing you some funny things on the X-ray, but show us the tip of the dilator. There you go. And there's the guide wire. Let's get an AP view. I like to look at the lateral and AP view. It's essential to have 2 views. Remember, the body is 3-dimensional. You need at least 2 views to get that sense of 3-dimensionality. All right, you can see the guide wire goes off to the left side, which is what we want. I'm going to actually remove the guide wire, and I'm going to reposition the tip of the dilator before I go any further. Shot. I'm going to bring it a little bit to the middle over the disc. I like it to be a little more centered. Shot. When we go in. Let's get an AP view again. When you enter the front of the disc with the dilator, you want to be in the center. And sometimes that's not possible, but you want to be as close to the center as possible. She has a little bit of scoliosis there, so there's some twisting of the spine. But I'm going to do my very best shot to go in through the middle. There we go. Entering the disc. And I'm heading to the back of the disc where the tear is. Let's get another AP just to verify. Since we cannot actually see inside the body, there's no way to do that. We have to use image guidance, which is the X-ray machine. Let's take a look at the lateral view. I still think we can do better. I'm going to come out and try to... She must have some anatomy that's forcing my dilator to the left, which I don't like. Shot. I'm back out. I'm going to try to move a little bit more to her right. Let's get an AP. Nope, you don't need to do anything. I just need to get a better starting point. There's something that's pushing me to the left, which I don't like. So I pulled out. I went further to the right. I don't like how far I am on the right. I'm going to go back just a tiny bit to the left. And it's very important that you make these corrections early on. And don't proceed until you're very happy. The reality is that this surgery is like all surgery, requires precision. You want to be very precise. If you make sure you're precise with everything you do, it's never going to be perfect, but it's going to be pretty darn close to being as perfect as you can get it. You'll get the best results possible. Yeah, there's definitely like a bone spur or something that's pushing me and sliding me to the left. Now let me just try one more time. I'm too far to the right now, so I want to correct to the left, and I can feel that there's definitely a little precipice there. Shot. That's definitely better. That's like perfect center. Let's get a lateral view. So you can see the spinous processes. She does have some osteoporosis, some loss of bone mass. We're not here to fix osteoporosis. We're here to get rid of this herniated disc. And I think we can do that. Let me try one more time like this. Shot. Let's get another AP just to verify we haven't slid. If you're going to do this type of surgery, image guided, percutaneous, endoscopic surgery, that's perfect. Then you really have to not settle for anything less than perfection and force yourself to do the very best for each patient, because if you compromise during spine surgery, you're going to end up with problems for the patient, and we don't want any problems for her. All right, I am now with the tip of the dilator at the back of the disc. You guys see that? I think we're off on orbit just a smidgen. Let's get the orbit fixed. I think that's really good, Jordan. I like that. So you can see the tip of the dilator is almost at the herniation. I'm just working my way back there just carefully to the back of the disc. Show us where the back of the disc is. You can see the back wall of the vertebrae. That's a bone spur. Come down there. You see that line go down to the bottom of that vertebrae. See that gray line right there? Follow the line at the back of the vertebrae. That, if you extend it up, is the back of the disc. So we're right there at the back of the disc, and you can actually still see the herniation right there. I'm trying to get into the herniation a little bit. Is that it? Shot? Yeah. Just moving a millimeter at a time. All right, that's good. That's about as good as I can get. Now, here's the tube. We're going to do the whole surgery endoscopically through a 4 millimeter wide tube. That's why this surgery is bloodless. I made a 4 millimeter incision, and now we're going to bring our tube, it's called shot, tubular retractor. So you see the dilator move back a little bit. The reason it moved towards me is because she's got so much inflammation in this disc herniation, her body attacking it, trying to get rid of it on its own. She can't do that. I'm going to go get rid of it. But that inflammation literally pushed the metal dilator backwards, trying to get rid of it, trying to push it out because of the pressure. All right. See, it went back again. Shot. We're going to have to correct it in a minute, but we're going through her disc to get to the herniation. That's the beauty of this surgery. Developed by the Koreans, the South Koreans, Dr. Sang-Ho Lee, that's who trained me, Dr. Gun Choi. They were the first, the pioneers, to do this, and they did it, they trained me about 19 years ago. I had to go overseas to train. They're from South Korea. Woodydal Hospital founder and president, Shot. A true giant in the world of endoscopic, minimally invasive spine surgery. All right, that's good. I'm happy. Show us the tube, Jordan, where the end of it is. We're literally in the back of the disc at C4-C5, right where the herniation is, base of the herniation is, right where the tear in the annulus is. So there's a tear in the wall of the disc in the back wall, and that tear has allowed the jelly in the center of the disc to escape. It's stuck inside the tear, but it's also protruding backwards. We're going to go in and try to remove as much of that as we can. We use what's called the endoscopic rig, which is our camera, endoscope, irrigation, laser fiber to do the surgery. Now, this surgery we're doing is in the United States. Everything we're doing is FDA approved, and I've been doing this particular surgery now for almost 19 years. I need to advance this. This is, I don't know what you're doing. I need to have access to this. All right, you can cover it now. All right, lasers on the proper setting. People ask about lasers. Can they damage the patient, hurt the nerves, hurt the body? No. If they're used properly, they cannot. The only time a laser is dangerous, like any instrument, whether it's a scalpel, a rongeur, a retractor, all of those instruments can hurt people if they're used improperly. So you have to be trained on the laser, like I have been. And I've been certified and trained on using the medical laser. I've been using it for 19 years now. And I've done over 2,200 surgeries with the laser, including this one, cervical, lumbar, thoracic, and never had a single complication related to the laser. So the laser is a very, very good tool. It's very useful, very helpful. We cannot do this type of surgery without the laser. It's essential. It's not a gimmick. Now there is a company that is no longer in business called Laser Spine Institute. They used to not use the laser. They would just put it in their name, but they never actually use the laser. The way I know this is for several reasons, but most importantly, I had neurosurgical friends working there who said that they never used the laser. They just sold it as a laser procedure, but they did microdiscectomies. And in the cervical spine, they did foraminotomies. So it's the same thing that other neurosurgeons do, nothing special. What we do, on the other hand, you can see we are using the laser. There's a bone spur right there, by the way. I just zapped. All right, that bone spur is now gone. The laser is really good at removing bone spurs. If you have questions, type them up. I'll answer them for you. In the meantime, Henry, let's show the audience why do herniated discs, bulging discs. You can put the thing here. It's just I needed to advance the fiber. To do that, I had to lift or push down on the lever and then re-engage the lever. Okay, so you got to wait to do that until I'm done setting the laser fiber length. All right. So Henry, let's let the audience see why do disc injuries cause neck pain. They're the most common cause of neck pain, folks, disc injuries. Whether it's a herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, they're all the same thing. They're disc injuries. There's really not much difference between all those different names. They're the same thing. And they are the most common cause of neck pain. Let's show the audience how they cause neck pain.
Copy that.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Oh, good. Welcome back. You can see from the video that the way that disc injuries cause so much symptoms is inflammation. And if you look here on the surgery, the laser fiber is zapping away material that's inflamed material. And what inflammation does is if you let it go for weeks and months or even years, it creates scar tissue. Inflammation is a natural process that normally happens in your body. It's part of healing. The body is literally trying to heal the herniation, but it can't. The way inflammation works is it attacks and destroys first. So it's a lot like a military moving in and attacking. It's setting off bombs and using rockets and mortars and bullets, and it's just trying to destroy the enemy. So the first thing your inflammatory system does with a herniated disc like this is it attacks it and tries to destroy it, remove it, destroy it and get rid of it, get rid of the enemy. Then it starts to rebuild after it destroys the enemy. And the rebuilding process is when scar tissue is formed by fibroblasts. So the initial cells in inflammation are destructive cells like neutrophils and mast cells, and they're called polymorphonucleocytes. And then you have the cleaning up team, which includes macrophages, and then you have the rebuilding team, which is fibroblasts, and they create collagen and elastin. And collagen and elastin is what scar tissue is made out of. And it also happens to be what your disc is made out of, the back of the disc. So the wall of the disc that's torn, that allows the herniation to occur, is made out of collagen and elastin, and your body rebuilds it after we clean it out. But her body has been trying to heal this for years, like 20 years now, and it's been unsuccessful because the herniation cannot be removed with inflammation. Your inflammatory system is not able to remove a herniation. It just isn't. And the reason is the herniation is made of nucleus pulposus. Nucleus pulposus is a very, very difficult material for your body to remove and get rid of. And the disc is poorly vascular. There's not much blood supply. So the inflammatory response is so slow. It takes many, many years, and all it does is result. Look at that herniation right there, coming back. That was pushing on her spinal cord. Now it's gone. See that? We just sucked it right out of the tube.
We saw it, yep.
That's the whole point of the surgery. Now, other doctors, other surgeons, if they saw this patient like they did, they would recommend a fusion, ACDF, because that's all they know how to do. It's an old-fashioned surgery, and I'm trying to get people to stop doing fusions because they're unnecessary now. Now that we have this surgery with the laser, you don't need to do ACDF or artificial disc anymore. Those surgeries are old, they're dangerous. The complication rate for fusion on the neck like this is 50%. It's documented at 50%. That means 1 out of every 2 patients will have a complication. You don't want complications, folks, when you're having spine surgery. So ACDF fusion, 50% complication rate, highly invasive, old surgery. It's around almost 100-year-old surgery, and it should not be done anymore, okay? Should not be done anymore. The next surgery that people recommend is artificial disc. And again, very high complication rate. I strongly recommend you avoid it. This is the best surgery in the world for a disc problem. Right here, you're watching it. There's another piece of herniation coming out. Too big to fit. We're gonna have to zap it a little bit, shake it, and get it out. You can see it coming out of the top of the tube. Okay, that's how we do this. We use the laser to release the herniated fragments because they're scarred with scar tissue, and we just migrate them right out the tube. All right? Like bringing oil out of the ground. You use a tube to bring the oil up and out. I say that because we just had an election 2 days ago, and Donald Trump, he won the election, and he says, drill, baby, drill, right? Isn't that what he says, drill, baby, drill? And so what he's talking about is getting oil out of the ground using a tube. All right. We'll take the question, and then we'll come back to the surgery, and we have some more video animations. And as a matter of fact, before we do the question, let's show the audience how this surgery actually works to repair discs instead of fusing them.
Of course.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And welcome back. So you can see from our video animation how the surgery works. Basically, we get to the back of the disc using a skinny little tube, and then we bring a scope in so I can see what I'm doing. And the scope actually gives us tremendous amount of resolution. By the way, type your questions up. I'll answer them, I promise. I know I haven't answered any questions yet, but I will. I just have so much to talk about. And I want the audience to understand the scale here. You guys see that glass fiber at the end, the laser fiber? That is 0.5, half a millimeter wide, half a millimeter. Now, if you take your fingers and spread them apart just enough to barely see light, that's 1 millimeter. So imagine what we're seeing here, half a millimeter, right? It's so tiny, and yet it looks big, right? It looks big. And the reason it looks big is because we're magnifying. We're magnifying the actual everything down here. And that's important because by using magnification and illumination, which is light, we're able to see and treat this disease on a level that no other doctor can do. So normally spine surgeons that do this kind of, they treat a herniated disc like this, they cannot see this much detail. How do I know? Because I'm one of them. I've done spine surgery like this for years. I've done 1,000 fusions on the neck and artificial discs instead of laser. That was before I was doing so much laser surgery. And you cannot see this detail at the back of the disc. As a matter of fact, most surgeons that do disc surgery on your neck, they can't see anything. They're just scraping down there hoping that they get the herniation out. But it's not safe. That's why complications are so common. But when you use an endoscope, you're getting the very best view at the back of the disc. You could see millimeters and half millimeters and 1/10 of a millimeter. That's a bone spur right there. See, I just shaved it down with a laser. Literally, I can control this laser to remove tissue at 1/20th of a millimeter. That's a millimeter divided by 20. And I'm removing bone spur at 1/20th of a millimeter at a time. Talk about safety. That is the safest, best you can do. Now, all of this, a lot of this is scar tissue, all right, from chronic inflammation. And we just have to be really careful because we don't want to get through the scar tissue and into the spinal cord. That would be really bad. So I've got to remove as much of the herniation as I can. I want to get as much pressure off the spinal cord as I can. But you can already see it's starting to expand. It's starting to come back to its normal shape, right? Because I've removed the herniation. And you can see the pocket where the herniation was really bad. I've got to just see if I can get a little bit more. I don't want to leave too much here. And by the way, we never get 100% of a herniation. That's something everybody needs to understand. There's no surgeon on earth that can remove all the herniation, not even close. We are happy if we get 60% and we get the pressure off the nerves typically. And that's what I've done. Wow, the spinal cord is already re-expanded. That's incredible. So there's just a little bit left and I think we're done here. I don't want to gild the lily. I don't want to do anything that would hurt her. So I think we're done. I mean, I probably got 60 or 70% of that herniation out. We call it a debulking. We're taking the bulk of the herniation out. I want you to notice we lost zero blood, not a drop of blood. And we're done. And there's a 4 millimeter incision. So she avoided fusion. She avoided artificial discs. She avoided cadaver bones going in there to do the fusion. She avoided biologics. She avoided everything bad about spine surgery. She's going to go home in an hour. Henry, let's show the audience basically what facet joint pain is. That's the second most common cause of neck pain, is facet joint pain. Scope use is a 5. Okay, you've seen now what actually causes facet joint pain. It's the same thing that causes disc pain. When you have an injured disc or an injured facet, it's inflammation going on in that injured joint that causes the pain. All right, there's the incision. It's literally 4 millimeters long. You guys see that?
Yes, we do.
And we lost 1 drop of blood for the whole surgery. We're going to put a little Band-Aid. We're done. My team did a great job. I'm going to come and answer your questions, so type them up. But you're watching live spine surgery from Duke Spine Institute. We broadcast live so you can ask questions and so that you can see the truth. We don't hide anything. We don't edit it. We're not doing, gruesome things to her body and you can't see it. That's why other surgeons will never show you their surgery, because they're so invasive and bloody and damaging, they don't want you to see what's happening. They just want the patient to see a tiny little cut that they did for their surgery, and the patient thinks, oh, it's just a little cut, everything's good. What you don't know is that the surgeon did major damage inside your body to all your muscles and soft tissues, and that's why there's so much pain and suffering after normal invasive spine surgery. You don't have that with this procedure because we're not doing damage. This is truly revolutionary. You're watching the future of spine surgery here at Duke Spine. We've been doing it for almost 20 years. We're trying to get the word out so people don't go and have horrible outcome surgeries like invasive surgery. All right, I'm going to come and answer questions. In the meantime, Henry will show you how we treat facet joint pain.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Dr. Duke Majan, CEO and founder of Duke Spine Institute, Duke Joint Institute. I'm here with our patient from
Louisiana.
That's right. I had to have him say it. It sounds better when he says it. Why did you come all the way to Florida to the Duke Spine Institute?
Well, about 3 months ago, I was scheduled for a cervical disc fusion in Shreveport, Louisiana. Had done all the pre-op stuff, was scheduled within 2 weeks to do the surgery, got to work and started doing some research. The more I read about what they were going to do with the fusion, people having trouble with it down the road, above and below the fusion, decided there had to be a better option. So that's when I found Dr. Duke and his team and started watching some of his videos. Pretty impressive.
And you're a YouTube guy, you were
Yes,
telling
sir.
me, so you found us on YouTube. And what did you think?
Well, our first impression was any doctor that will put his livelihood live on YouTube, showing all of his surgeries, putting it out there, believes in what he's doing. That's not many doctors would do that.
Not just because of that, but because, afraid of complications, which, praise God, we haven't had a complication. We've been doing it now for 17 years. I want people to know there's a safer, better way to take care of their problem other than metal, fusion, stimulators. That's really the message there. You got that message loud and clear.
I did. My surgery was less than 24 hours ago. So far, the tingling, numbing going down my arm is non-existent. it's went away where it was there constantly all the time before. So hopefully this continues on.
Oh, it's gonna continue on. Our results are permanent with the laser surgery. And you can see your tiny little incision right there. It's a 4 millimeter. You can see we went in with a little tube into your disc. I was able to get both discs fixed. You had a lot of herniations in there. Something a lot of people don't understand. They think that a herniation is one piece, but it's about 30 pieces on average. And you had about 30 pieces in each of your discs. They were hard to get to, but we got it done. And I was very happy with the end results. We got all the pressure off the nerves, and we fixed the tear in the back of the disc. Less than 24 hours, here you are. You're doing fantastic. Now, what did your wife think about you coming down here to Florida? Was she supportive?
She was. This problem had been going on for many years. Started out on my right side years ago and had some stuff fixing that, but she knew the problem I was having. I'm very active. I'm a scuba diver, a motocross racer, do a lot of active sports, and she said, we've got to get this fixed. I'm too active still to actually quit all this. I don't want to quit, so this fusion just seemed like it was going to limit my options on doing things. So that's why we come down here. She was very supportive, and we decided to sign up and come on down.
What do you have to say to your insurance company? What do you want them to do?
I sure hope they pay, because I know they would have paid on the fusion deal, but why they would not pay on this, I don't know why, because results are immediate.
And no narcotics?
No, haven't taken a pain pill, haven't taken anything, nothing. Slept like a baby last night.
That's right. And after fusions, a lot of patients end up in pain management. They're getting shots, they're getting pills.
They can't talk, their esophagus is all tore up from them pushing it out of the way.
That's right.
And I have none of that.
Yeah, our patients don't go to pain management because they don't need it. Anything else you want to say to your fans out there?
If you are considering having some type of neck or back surgery, I think you ought to look at Dr. Duke and his group, because they got a great facility down here, very accommodating. They'll help you with travel, whatever you need. We flew down Sunday, today's Wednesday, and we're going to stay till Sunday, enjoy a little bit of Space Coast. Hopefully get to see a rocket launch here on Friday morning.
That's right. You can see the rocket launches from here and feel them. All right, sir. It's a pleasure.
Thank you, sir.
My pleasure. You have a great day.
Okay.
Let's get you guys out of here. You got better things to do than to sit in a doctor's
Exactly.
office. What a great testimonial from one of our patients here on the Space Coast of Florida at Duke Spine Institute. So this patient, we've just completed her surgery. We went through the front of her neck. We made a 4 millimeter cut, unlike other types of invasive spine surgery done elsewhere, where they're trying to fuse the spine using metal. This patient, she didn't want metal in her spine. This is actually a cervical spine, as are these other ones, and you can see what a metal plate looks like. And most people, if they knew what their surgeon was recommending, they wouldn't do this surgery, because not only are you having metal and plastic put in your body permanently, but also it creates a massive amount of damage to the soft tissues in this area to get here, because the surgeon has to cut, and move things over, and then they're on all this bleeding muscle and tissue. And that's why people that have spine fusions and artificial disc surgery, they have so much pain afterwards. They're taking narcotic painkillers. Tell me one spine surgeon who doesn't give their patient narcotic opioid painkillers after invasive spine surgery. They all do. And their patients are on these junk, horrible drugs, painkillers that are dangerous for them for literally weeks and months after surgery. Why? The reason why you're having pain after spine surgery is because of the trauma and damage to the normal parts of your body done by the surgeon. If you'd like to know more about that, go to our YouTube channel or our website, dukespine.com. Look up the laminectomy section, laminectomy. You'll see what I'm talking about. Cuts, destruction of soft tissues that are normally not doing anything. They're just in the way. And the surgeon has to rip it all up to get down to the spine to do the job, right? Well, not with the Duke laser disc repair. The surgery you just watched, the first of its kind, endoscopic, minimally invasive. There's no trauma inside. We don't give our patients any narcotic or opioid pain meds after surgery. Why? They don't need it. There's no pain. Why is there no pain? Because I, the surgeon, during the Duke laser disc repair did not do damage to their body. Therefore, there is no new pain. Therefore, they don't need painkillers. This is a very important point, folks. I don't know if you realize this. It took me a long time to figure this out. But spine surgery is destructive to your body. It damages the normal parts of your body, causes horrible pain and suffering, requires months and years of painkillers and therapy to recover from the surgery itself, but not with the surgery we just did. If you want less invasive, better surgery for you, healthier, safer, you come to Duke Spine Institute, get the surgery done here. This patient traveled here. She had the cervical C4-C5 disc cleaned out with a laser. She's going to go home in literally an hour, and she's not going to have pain. She won't need any pain medications. She won't need any painkillers. And tomorrow morning she's going to come in for a quick checkup, and then she can drive herself home back to the villages where they come from. Everything went great. There was a lot of scar tissue. Clearly you could see in this video that the disc herniation was pushing against the spinal cord. We cleaned it all out, got the pressure off the spinal cord, got a few big chunks of herniation out, along with a lot of little ones. We got some bone spurs out with the laser as well. You can see how safe the laser is. It's the safest instrument in the world for surgery. The laser is the safest if it's used properly. There are lots of surgeons who don't know how to use a laser properly, and they cause pain and suffering for the patients. Not us, not at Duke Spine. All right, we're going to take some questions, and then we're going to be back again in 45 minutes to an hour where we have a second cervical laser surgery. And this next patient, he comes from Turkey. All right, anybody know where Turkey is? I'm not talking about Thanksgiving Turkey. I'm talking about the country Turkey. He's coming from Turkey here to have 2 disc herniations repaired with a laser. Why? Because this surgery that you're watching is not offered anywhere else in the world. It's only available at Duke Spine Institute. I am the pioneer who created it and figured it out, and we've been doing it now for almost 19 years with over 2,200 patients treated. That said, before I was an endoscopic laser surgeon, I did fusions like this, fusions like this, fusions in the lower back. I did over 1,000 fusions on the neck, so I know what fusions and artificial disc surgery involves. I did an artificial disc as well. As a matter of fact, I was being trained in artificial discs when they were first released in the United States by the FDA back in early 2000s. As a matter of fact, my institution where I trained at UF in Gainesville was one of the first universities to put in artificial discs as part of the FDA testing and protocols. So I had the ability to experience artificial disc surgery from the very beginning in the United States. Of course, in Europe, they were putting artificial discs in much longer than America, and they had been putting them in for 20 years earlier than the United States. But a lot of the early artificial discs were horrible. The patient outcomes were horrible. The artificial discs failed. They popped out. They rolled out. They caused all kinds of complications. And I will tell you this. In the United States of America, artificial discs are promoted by companies that sell them, and they promote them to the surgeons. And for the first 10 years, there was so many complications from artificial discs, but the companies buried the complications. They hid them from the public. They hid them from the surgeons. I know about them because I was part of it. I wasn't part of the hiding. I was part of the group of surgeons. There were about 100 that were putting in artificial discs in America in the very beginning in the early 2000s. And a small number of those surgeons would be honest about the results. They were not on the take. They were not bought off. And they would report horrible complications from the artificial disc popping out. All right? But those complications were suppressed by the industry that sells the artificial disc. Those surgeons were basically shut up. They were side railed. And the conferences that were happening where we discussed these complications and how to avoid them and how to prevent them, they went away. And they were replaced by conferences, educational conferences, where complications from products were not even mentioned. Just good results were mentioned. So that surgeons were brainwashed basically by the industry. And I have a movie coming out in January. It's a first of a series of movies, hopefully, that's going to expose the entire spine industry and how corrupt it is. And so the public can actually know the truth, because what you're up against, nobody else is going to tell you this. But I feel it's an injustice, and it goes against my code of ethics and morals as a doctor, which I swore an oath called the Hippocratic Oath to patients to take good care of patients. Other doctors have foregone that oath, and they have been corrupted by the industry. So you need to be aware of that. All right, we're going to take some questions, and then we've got another surgery for you, a 2-level cervical Duke laser disc repair, endoscopic laser-assisted C5-6, C6-7 on a patient from Turkey. And then we got 2 more surgeries today for the lumbar. We have a patient from Vietnam. He's getting 6 areas of his disc fixed, six spots, basically 3 discs, bilateral. I think it's L2, 3, 3, 4, 4, 5. He's been watching my surgeries for 4 years, finally made it out here to get surgery from Vietnam. And then we have 1 more surgery at the end, which will be a lumbar Duke laser disc repair as well.
Alrighty.
Let's take some questions. Thanks, Laura.
First question coming from Adam on YouTube.
How appropriate.
Yeah.
First question from the first man, Adam. I like that.
There we go. And so he also has another question, but that's coming up. First question asking, what's the best surgery for cervical stenosis radiculopathy?
Adam, the question that you asked is, what's the best surgery for cervical stenosis and radiculopathy? You just watched it. It is the Duke laser disc repair. It is this surgery. This patient had exactly that. She had a herniated disc in her neck, right? That's the red thing sticking out, hitting on the nerve, hitting on the spinal cord being right there, the yellow thing. So the nerves come off the spinal cord. The herniation was in the foramen and it was paracentral. I went in through the disc, zapped out the herniation, left the disc alone. Keep your natural disc. You just watched the best surgery in the world, Duke laser disc repair.
Next 2 questions coming from Lanu on YouTube.
Hello, Lanu. Welcome.
Both being a political question.
Oh, boy.
First one being, will a new President Trump reform the healthcare and health insurance, which may have a positive impact on your practice, to your practice?
So Lanu is asking a political question. And Lanu, with all due respect, I like you. You come to all of our surgeries. I avoid politics just because I think it's not appropriate for me as a doctor. Who cares about my political views? I'm a doctor. I'm supposed to take care of patients and have medical views. So I will refrain from digging too deep into this. Here's what I will say. I don't know if Trump or Kamala would have done a better job at reforming our healthcare system in America, but we need reform desperately, which is why I do these broadcasts. I need the American people to hear the message, to learn the truth. If they knew the truth of what's happening in healthcare, if they knew all the pieces to the puzzle, if they understood what's happening, they would demand change, just like they demanded change during this election and they got rid of the Democrat Party, the leftist party, and they elected Trump. That said, I personally believe that the Democrat and Kamala's stance on reforming healthcare, getting rid of the private companies that are profiting off of people, I think that's a good thing, personally. Somebody needs to reform the health insurance companies. They are far too powerful. There is nobody over them. They are the most powerful organization in the world. They are the modern day mafia. And what they do is take your money as a premium payment. They promise you they're going to cover your medical expenses. And then when it comes down to getting the best care, they don't. They won't pay. They deny payment. And that's why hospitals are going bankrupt today. In America and other countries, they're going bankrupt at a rate that we've never seen before. You see, there used to be 5,000 hospitals in the United States. And now the numbers are dropping off because the insurance companies are denying payments. They're not paying for the medical care that patients are getting at those hospitals. So who's paying for their medical care? Well, the hospital is. Hospitals can't pay for medical care. They don't have a source of revenue if it isn't the patient or the insurance company or the government. So the hospitals get their money from the insurance companies. If the insurance companies stop paying them, the hospitals go out of business. So the insurance companies are targeting hospitals they want to put out of business. They're closing off and choking off the hospital's revenue stream, which causes the hospital to go bankrupt, which causes then consolidation of hospital systems. It causes the hospital systems then to sell themselves to the insurance companies because the insurance companies are now buying up hospitals. Why? That should scare you because think about it. You go to the hospital, I've got a brain tumor, I'm dying, and the hospital is owned by the insurance company. The insurance company says, you don't need any surgery. You just need to die. We're going to put you in hospice. All right, why? Because they're saving the money that it would cost them to do the brain surgery. You see, by saving that money, they're more profitable. They get to keep it as a profit at the end of the year because they didn't spend it on your brain surgery. That's exactly what's happening in America. To give you perspective, when I was a young boy, I was around 7, 8, 9, my father was a doctor practicing in California. At that time, the insurance companies did not do denials, okay? And there were no copays, by the way, either. But they would deny only when the doctor made a mistake with ordering. Like, let's say you go to the doctor and you have a headache, and the doctor orders an MRI of the knee. Well, the insurance would say, why did you order an MRI of the knee? The patient has a headache. Oh, you're right. I'm sorry, it should be an MRI of the brain, right? So that's called a denial. They denied covering the MRI of the knee because the problem was the brain. That's a good denial. That's okay. That's how it started. But over the last 40 years, those denials have gone from being good denials for the right reason to they deny everything that the doctors are ordering. We used to have 1 million denials a year 40 years ago. Now we have 2 million denials a day by the insurance company. Think about that. They are unregulated in their denials. There is no government law, there's no policy, there's no politician, there's no president that can stop the insurance companies from saying no to paying for your care. And if they say no, you're not getting that care. That is the biggest problem in America. That must change, or we're all going to be, we're already in bad shape as it is. I don't know how much worse it can get. But if Trump was going to do one thing to help the American people, besides getting rid of drugs, I think, I don't mean good drugs, I mean bad drugs, and violence. I think that reforming healthcare is the most important issue in America today. That's my opinion.
All right, next question coming from Hookum1963 on YouTube, asking, if I send you my CD for review, will I get it back? Should it be sent by certified mail? Thank you.
Yeah, so Hookum, on our website at dukespine.com, we have a form you fill out for an MRI review. You get it for free. I meet you. I'll tell you exactly what's wrong. I'll give you your diagnosis. Then you'll know what's wrong, and I'll tell you how to fix it. As far as the CD you send, we will send it back to you if you send us a pre-addressed and paid envelope. We're not going to pay for the postage. If we pay for everybody's postage, we're spending hundreds or thousands of dollars a month. It makes no sense. We're not going to pay for postage. So if you send us your CD and you want it back, put a note. Please send this back when you're done and give us a self-addressed, prepaid postage envelope, and we will pop that CD back in there and send it to you.
And then these next two questions, they're kind of a similar question. The first one is from Ravi Sankar on YouTube, and then the next one's from Adam, once more on YouTube. Both ask, first question being, is the surgery covered by insurance? And Adam asks, do you take Medicare or Medicaid?
Yeah, so these are two questions from our audience about insurance. Is the surgery covered by insurance? It all depends on what insurance you have. Many insurances, like Medicare, will not cover this surgery. Medicaid will not cover it. They don't want you to have it, because if they cover it, more people will want it. If more people want it and get it, then they're going to pay more bills. Then they don't get to keep their money. So the government wants you, patients, to have horrible, shitty, dangerous, invasive surgery as your option. Because if that's all you have available, you will not get it done. And guess what? They get to save the money. They're not paying for your medical care. They are playing games with you, and that is not something I can fix. It's something you're going to have to fix. It's your insurance. My insurance does the same thing. I have United Healthcare. They denied my sinus surgery. I paid for it with cash. Did I need it? Absolutely. Should they have paid for it? Absolutely. Did they pay for it? No. Why? Because who's going to force the insurance company to pay the bill? Tell me. Superman? Batman? Robin? Spider-Man? Who? God? God has not done anything to force the insurance companies to pay bills. You think the president will? They don't give a shit. You think Congress will? They're the ones letting the insurance companies get away with it. The insurance companies have lobbyists. They pay millions of dollars a year to lobby to our government to allow them to not pay for your medical care. All right? You want to fix it? you need to go to the government and get it fixed, not to Dr. Duke or Duke Spine. We do the best surgeries in the world. Whether or not they're covered by insurance, that's your problem. If your insurance sucks and they won't pay for your care, you got to deal with the insurance, not us. It's not our fault that we have the best surgery in the world and your insurance won't pay. That's your fault for letting your insurance not pay. So, will Medicare cover this? No. Will Medicaid cover this? No. I can tell you that right off the bat. Have we had patients then do the surgery, pay for it out of pocket, then this patient bills their Medicare Advantage plan? Yes. Have they gotten paid? Yes. Will the Medicare Advantage plan pay your surgery? I don't know. That's between you and them.
And that is it for questions.
All right. We're going to be back in about 30 minutes with our next surgery. It'll be 2 discs fixed with laser. Once again, best surgery in the world for a herniated disc in your neck or stenosis